Welcome to today's Explainer. I'm absolutely thrilled you're here with us today because we're diving into a massive, fundamental shift happening right now in patient acquisition. We're going to explore exactly why AI search might be completely ignoring your dental practice, and much more importantly, how we can transform your practice into an AI-recommended industry leader. So let me ask you something that's kind of jarring to think about. Right now, today, does AI actually recommend your dental practice, or is it recommending the competitor down the street? Because here's the new reality. High-intent patients are no longer just scrolling endlessly through Google. They're actively asking ChatGPT, Perplexity, and Siri to find them a dentist. And the hard truth we have to face is, if your online presence isn't specifically architected for AI, you're completely invisible to them. Literally invisible. The traditional Google search patient journey, it's shrinking. And it's shrinking fast. You know, in the past, patients would click through 20 blue links, browse a dozen different websites, and take their time before making a decision. Well, not anymore. AI doesn't do that. It synthesizes a confident answer and gives them just 1 to 3 specific recommendations. If you are one of those recommendations, you are capturing the absolute highest converting leads out there, patients who have already decided they need care and are fully ready to book. Okay, let's dive into our strategic roadmap for today. We're going to quickly cover the AI search reality, passing technical gates, passage-level clarity, building expert authority, scaling DSOs, and finally, our diagnostic-first architecture. Consider this your definitive guide. All right, Section 1, the AI search reality. Let's talk about why AI-referred patients are fundamentally different. Before we go fixing anything, we got to diagnose exactly why traditional digital marketing strategies are just failing in this new AI-driven era. Think about the stark difference here. On one hand, you have your traditional ad-click patient. They need a ton of convincing, they're constantly comparing you to 5 other offices in the area, and they are highly price-sensitive. But on the other hand, look at the AI-referred patient. They arrive with trust already established because they literally view the AI as an objective expert recommender. Honestly, they're practically a pre-closed patient with drastically lower price resistance. It's a game changer. Moving on to Section 2, passing the technical gates, or why beautiful websites remain entirely invisible. We really need to talk about the technical mechanics for a second, because before an AI can even begin to evaluate your incredible clinical expertise, it literally has to be able to access and read your site. And there are these hidden technical gates that trip up so many practices. Things like crawl access restrictions, JavaScript rendering failures, content buried in tabs or pop-ups, slow load times, and missing semantic structure. Just think about all those cookie-cutter dental website templates out there. They so often use these heavy JavaScript menus or flashy animated sliders. Well, that causes critical data, like your doctor bios and specific services, to fail silently. It completely blocks the AI from even indexing you. Section 3. Passage-level content clarity. This is all about how AI actually reads your website. Now, what's really interesting about this concept is the massive shift in how an AI system evaluates your page compared to a regular human visitor. Understanding this changes the game entirely. It's all about passage-level clarity. You see, AI breaks a single page down into roughly 15 to 25 isolated passages, and it judges each one completely independently to find specific, clear answers. This means that vague, fluffy marketing filler text actively dilutes your overall signal. Every single paragraph on your page has to independently answer a patient-specific question if you want to be cited as the expert. And that perfectly tees up something called query fanout. When a patient asks an AI one simple question, the AI simultaneously expands it into a whole network of related questions, things like cost, timeline, and alternatives. It does this to satisfy every single stage of the patient's decision journey all at once. So from awareness to consideration to decision and finally action, your content must comprehensively cover all these nodes to win that coveted AI recommendation. Make sense? Which brings us to Section 4, from generic to expert authority, building genuine trust. So how exactly do we take generic, kind of boring service pages and turn them into expert-level dental content that AI actually wants to share? Let's contrast two entirely different approaches. Picture Practice A. They have a standard, generic 500-word page. Sure, it's technically readable, but it's totally invisible to AI because it sounds exactly like 100 other sites. Now picture Practice B. They have a super focused 300 words that feature real patient outcomes and exact pricing transparency. Practice B gets chosen every single time. Why? Because it provides genuine, highly specific, answer-worthy value. The absolute crucial point here is mastering what we call information gain and topic depth. Genuine trust is built by providing specific clinical details that an AI simply cannot scrape from your competitors' websites. We're talking about incredibly specific things like 93% biting confidence data, your distinctive clinical training, the exact benefits of the technology you use, transparent market pricing, and honestly, just giving real answers to difficult questions like implant failures or dental anxiety. Let's move to Section 5, Scaling Multi-Location DSOs, Dominating Regional AI Recommendations. For the DSO executives tuning in right now, listen up. Let's talk about the DSO compound advantage. One unified brand plus localized depth equals exponential regional revenue. And this brilliantly illustrates how our architecture scales consistent, localized search authority across multiple office locations, allowing you to completely dominate regional AI recommendations. Expanding to new locations actually compounds your total network revenue when you have established domain authority. Instead of diluting your search signals, you are building an absolutely unshakable digital fortress. But here's the catch. You absolutely must localize that DSO content. You've got to tailor your pages to specific community demographics, highlight the individual local doctors at each practice, detail location-specific services, and address local insurance contacts. Our systems are built to seamlessly manage this incredibly complex multi-location content. We prevent that awful over-centralization, and we eliminate thin local pages. That way, DSOs scale their brand authority while maintaining unshakable local relevance in every single market. Finally, Section 6, the Diagnostic First Growth Architecture, the DVYNS Blueprint. Okay, let's move into the solution phase. How do we actually architect these systems from the ground up to move practices from totally invisible to industry leaders? Well, we never guess. It really comes down to diagnosing two distinct hurdles. First, you could have a technical access failure. This requires a structural fix because the AI literally cannot find your content. Second, you might have a content quality failure. This means the AI found you, but it confidently chose your competitor instead. That requires genuine, practice-specific development. Our process always starts by diagnosing exactly which issue is holding you back, guaranteeing absolutely zero wasted budget. Here are the exact 4 stages of our diagnostic first growth architecture. Step 1, a comprehensive diagnostic audit. Step 2, practice-specific content extraction. Step 3, technical architecture optimization. And Step 4, DSO growth scaling and governance. This is a clean, proven blueprint to take you from being ignored by AI directly to the top of its recommendation list. I know you're wondering, how long does this take? Well, here is a very realistic timeline to AI dominance. Within the first 4 to 8 weeks, all those critical technical crawl issues are resolved. Then, in the 3 to 6 month range, the really deep, content-driven AI citation improvements begin to kick in. And moving forward, it's ongoing. You enjoy compounding visibility across all your markets. The technical fixes happen fast, for sure, but building that deep content architecture builds compounding dominance over the months that follow. Now, when we execute this, we heavily prioritize high-value, considered purchase procedures. We're talking dental implants, full arch restorations, Invisalign, cosmetic dentistry, veneers, and emergency dental care. Why? Because these are exactly the high-value services where patients heavily rely on AI to give them a trustworthy, expert recommendation. And honestly, this is the difference when you work with us. We are exclusively dental growth partners. We collaboratively extract your real clinical expertise to build that passage-level clarity we talked about. This dramatically outperforms standard Google reviews, which, let's face it, just aren't enough for AI anymore. Plus, our exclusively dental methodologies simultaneously improves your traditional Google SEO. We handle all the heavy lifting so your clinicians can focus completely on what they do best, patient care. I want to leave you with a really powerful thought today. Stop losing high-intent patients to competitors. Become the practice AI trusts, cites, and recommends as an industry leader. The window to establish this authority in your market is open right now, but it won't be forever. We absolutely want to be your growth partners in this. Stop guessing and start dominating your market's AI recommendations. I want to highly encourage you to schedule your dental AI visibility diagnostic today at DVYNS.com. Don't wait until your competitors capture all this highly valuable AI real estate. Head over to DVYNS.com today. Let me leave you with this one final question. As the entire world shifts to AI search, are you ready to be the only obvious choice it recommends, or will you accept remaining invisible?